COVID-19 is a respiratory virus that's new to the United States and to the world. Symptoms that arise when you have COVID-19 are anything from no symptoms at all to fevers, cough, and shortness of breath. You can become very critically ill. Just in order to protect ourselves. Our ERs work differently, our emergent centers work differently. When we have codes, everyone is treated as if they have the disease in order to protect our respiratory therapists and our nurses that are doing those emergent issues. Personal protective equipment that everyone calls PPE is sometimes on short supply. It is something that we normally didn't think about much more than gloves when you're normally taking care of patients, but now we're doing goggles, masks, gowns, quite a bit more than what you would do on a normal basis of taking care of patients. People are wearing gowns. We have to wear masks and goggles all day, every day. So for the entire 12-hour shift, regardless of whether you're dealing with a COVID patient or not, in order to protect yourselves and to protect our patients, to make sure that someone isn't positive that we don't know, or just to make sure everyone in general is safe. We are using technology in a very different way, which sometimes poses some obstacles. They're using FaceTime for people who come in. We have phones on the floor that allow patients to FaceTime their family members. We also have some specialists who are using FaceTime and virtual visits to talk to patients that are COVID positive, as opposed to seeing the patient personally. This then helps keep our providers protected and still allows our patients to be seen. It's all a very different way of taking care of patients. The outpatient world has changed a lot as well, because a lot of patients are being seen virtually at home. They're not coming into the hospital, they're not coming into their doctor's offices, they're getting phone calls and having visits through various forms of technology. So it's a little bit of a struggle as everyone learns how to use the technologies and work through those bugs. I think in the long run it's very helpful, but it is very new and has changed the way we do things. COVID-19 has presented our hospital with a couple of struggles. I think that one of the struggles that we have is getting the amount of information out to the nurses and to the staff as fast as we can. The hospital does a very, very good job of letting everybody know what's going on, and but the information changes so quickly. Sometimes it changes within hours, that we have to make sure that information is out and to all of the staff so that they can stay protected and they can stay efficiently taking care of the patients in the best way they can. Because it's like a ever-moving, breathing process right now, sometimes is a bit of a struggle. The other struggle is definitely having enough of the PPE. We do daily inventory that we have to have by a certain time every day to make sure that we've got enough PPE. Some days we do, some days we don't. In the beginning, I think we were very nervous. Everything we were doing, were we doing it right? Were we going to take this home to our family? Were we going to be able to protect ourselves and our coworkers and our patients and at that time, family members? And we didn't know. It was a lot of uncertainty. Now that we've been doing it for a couple weeks, even though those units kind of look like war zones, they are well-oiled machines. They know what they need to do and how to do it, and they're doing a very good job. It is, however, very challenging and stressful. It is very challenging and stressful. There is a lot of emotion that goes behind taking care of these critically ill patients. Part of the struggle is that we have no visitors. So some of the times when you would normally have visitors in there when the patients are doing very poorly for support, that's not there. So it's now the nurse's job to not only care for that patient, but also be there to support them through some pretty critical and scary parts of their life and this disease process. We do have FaceTime, so people do FaceTime. However, some of these patients are intubated, so it's not really something that they can see. They do hear them, so there's a lot of that going on, which is helpful. But it is stressful for the nurses to have that extra burden. I think it's a burden that we always take on, but when it's a pandemic like this and it's a volume that we have, it's a lot of people that it tends to get a little hard. They have great attitudes. We have a lot of help and support from the communities that bring in food and beverages and parades and balloons and cards. And the other day they had 2 different parades came past our hospital, which was nice, and the nurses could get to the windows and see it, and not just the nurses, the techs and all of the people that work at the hospital get there and help and support us. So it does make for an exhausting and mentally challenging day. But we still come back and do it every day. It's kind of what we were trained to do, to help those who can't help themselves. And that's why most of us became a nurse.
Thank you to our nurses and doctors
for risking infection,
to protect me,
to protect me,
to protect me,
to protect me.
We love our guardians fighting COVID-19.